As a developing country, health in Uganda lags behind many other countries. Uganda has for many years had a near-critical shortage of trained midwives and trained lab technicians. The problem was especially high in rural, hard-to-reach and underserved areas where close to 70% of Ugandans live. Baylor Uganda received CDC funding to implement the SAINT project starting 1st October 2010 with an objective to increase production and equitable distribution of well-trained health workers throughout Uganda.
The SAINT project is a 5-year CDC-funded project. The full name is Supporting and Improving National Training Systems for Health Workers in Uganda. The context of this project was meeting a gap in the staffing of health workers in the country.
And it was very evident in this country that the numbers of midwives were very few if we were to achieve maternal mortality reduction and newborn. We needed to increase the number and skills of the midwives.
In particular, we had a shortage of laboratory workers and midwives. So the SAINT project was initiated to increase production of these health cadres, as well as ensure that there's equitable distribution across the country.
In 2010, when we started off the project, the country had a shortfall of 48% level of understaffing, meaning that the approved staffing positions were filled up to 52%.
So you'd find the most underprivileged districts, like those that were in the north, had even fewer than 60% of the required numbers. And to increase the numbers, we took a step back. Do we have the capacity as a nation to actually increase the numbers, even if we had the funds? And we realized that we actually did not have the capacity. First of all, in terms of infrastructure, then we realized that even if we had the infrastructure in some places, that the quality of the trainers was also lacking.
The goal of this project was to increase the availability and equitable distribution of trained healthcare workers in Uganda. And to meet this, we had 3 specific objectives. The first objective was to strengthen national systems in terms of planning, coordination, accreditation, certification, and supervision of training, both pre-service training and in-service training.
Actually, Baylor came in at a time when we had problems, especially in the training. So at that time, when we were talking about core subjects, we were just teaching subjects, and somebody passes exams, but most people don't look at the skills somebody acquires through training, which are required in what? In a place of work. So when Baylor came in, it was on the first step. We changed the curriculum from subjects to competency-based curriculum.
We developed the curriculum, the training curricula. We were overseeing the people who were doing this. We developed the training curricula and harmonized it actually.
Before, each institution, each school was setting its own test items and administering its examinations to its candidates. And then they were giving them certificates. But after formation of Uganda Identity Examinations Board, then the process was centralized. And then UHIB was in charge of setting test items, of moderating them, and then administering the examinations and marking the examinations centrally.
3 universities were each using different curricula to train the degree level of the lab. And these were Mbarara University, Makerere, and Kampala International University. So we supported the harmonization of those 3 curricula by setting minimum standards that each university was supposed to adhere to produce the lab scientists.
Now we find that the training is uniform throughout the country. So this is a new curriculum what we developed.
The second objective was to support pre-service training institutions to increase production of new health workers. And then the third objective was to support in-service health worker training and integrate standardized HIV training curricula into in-service programs.
We had very few people who were trained on the ground, and the issue of retention, especially in the hard-to-reach areas, was a big problem. The laboratory positions were filled only up to about 30% of all the available positions, and many of the people who were there were not qualified. So the whole intention of this SAINS program was to bring these numbers up and make sure that people go back to the hard-to-reach areas where they were already working.
Baylor sponsored some students for taking up lab training programs in Jinja and some other lab schools in the country. So there was an increase in a number of trained lab personnel.
First of all, we had issues of students failing to pay school fees. And in this case, the SAINS projects used to give us school fees for students up front for the whole course.
This was the first project that looked at bridging the gap in the laboratory services in terms of quality of training, because we did not deal with just producing numbers, but we dealt with quality, right from curriculum development. To me, that was very, very important.
We were able to give scholarships for the training of health workers, a total of 2,400 scholarships. For the midwives, we gave scholarships amounting to or totaling to 1,375. We gave 444 scholarships for laboratory assistant training and 399 scholarships for laboratory technician training and 91 scholarships for laboratory science training.
The program is delivered through both public and private not-for-profit training institutions.
I was trained, I got skills, knowledge and attitude in training laboratory health workers. And right now I'm transferring this knowledge and skills I attained from Tutors College onto these students.
I trained from Mengo School of Medical Lab Technicians in Kampala. I came back to cover the district. Okay, the main reason was that there was a shortage here, because it was a health center 4 and they had only one staff working in the lab.
The SAINS program really changed my life, because at first when I was trying to go to school, it was very hard for me to pay for my school fees, as I was looking after 2 of my siblings. So it was hard. I just applied knowing that maybe if I fail, I will ask for the dead year. Then later I got the chance of getting the sponsorship from the SAINS program.
I'm taking a course in midwifery. My parents are not well off, so getting their assistance brought hope in my heart.
It has made my dreams come true, because I wanted to be a medical personnel, but that tuition wasn't there.
And in terms of running the school, I think it also improved, because we were just banking on what students pay. This is private, not-for-profit institution, and we depend 90% on what students pay. But since Baylor was able to pay in large amounts, in fact, they would pay for the whole training, so we were able to use that minimally to run the school as we wait for the other students to pay.
I'm grateful that I'm here. I'm doing my midwifery, and inshallah, God willing, anytime from now, I'm proud that I will be making a good midwife.
So the intention was that we could actually lift up the number of qualified people down there in the laboratories in the lower level health units.
After my school, they helped me look for a job. They got me a job. So I came to Nkwazi Hospital because of this program.
The SAINS project has increased production and equitable distribution of well-trained health workers and has improved the lives of millions of Ugandans in hard-to-reach and underserved areas.
The community has benefited because at least there's a number of tests which were not being done before and which we introduced. We also reduced the number of overstay here in the lab of clients.
There's been a very big change in the percentage of mothers dying because of these midwives that are being enrolled in this program.
The school impacted skills of midwifery in me, and I'm now helping the mothers and babies in the community of Kalau.
I would say Baylor has supported the whole of Uganda through our students, because we get students who are coming from Soroti, coming from Mubende side, coming from Karamoja, coming from Lira sub-region, Acholi sub-region, then West Nile sub-region. And so these students, after their qualification, they go and serve the people.
However, the implementation has faced some challenges.
Our key challenge with regard to realizing our goal, the equitable distribution of health workers, has not quite been realized, because at the time when our students started to graduate, the ministry communicated lack of funds to deploy the graduates. So whereas we've achieved in terms of the production side, we have not quite achieved in terms of the equitable distribution of health workers.
The need for midwives is still there. We need these people, and I have not seen a project which is training midwives in large numbers like SENSE project. So if we could be able to do that, that would be very good.
The SAINS project has taken huge steps in addressing the near-critical shortage of trained health workers in Uganda.
We are proud the program has come to an end with some fruits. But there are still gaps, because in order for this country to achieve the sustainable development goals, we have not reached the peak in terms of numbers of health workers in any of the cadres.
It's unfortunate that they are winding off, but I wish they could identify another partner to continue with us. And I should also say that we are extremely grateful.
Just want to thank Baylor Uganda for the attention they gave to Ministry of Education, because most times Ministry of Education, the government, able to provide the funds for all what our needs, but it's through our donors or government partners that are able to do some of the activities which most government cannot accomplish.
I'm very grateful to the program still for sponsoring our students, because there are very many out there who have the brains but do not have the opportunity to come to school because they don't have fees.
I thank Baylor so much. I'm very grateful.
I never believed that I will ever upgrade, and I reached that level I'm on now. I really thank SAINS very much for the work it has done to us.
SAINS was able to go past our initial targets that we had worked together on. And so they produced many more health workers than we had even anticipated they would be able to.
Our call is that partners should continue complementing our efforts. Our guidelines are here, the scheme is quite good.
The curricula will outlive the project in terms of quality of training. Because when we developed curricula or revised them or standardized them, we were actually addressing quality of training for the health workers, because that was also one of the aim in our goals.
I'm proud to say that looking both at midwives and our laboratory assistants, technologists and scientists, they have been exposed maximally to quality clinical training.